Optimizing Telehealth, the premium resource for evidence-based strategies to enhance telepractice today. Brought to you by the Telebehavioral Health Institute. Enjoy this excerpt from the latest episode. To access the full episode and to get your continuing medical education and continuing education hours, visit us at Telehealth.org.
Hello, I'm Dr. Marlene Maheu, and I'm delighted to welcome you to the Optimizing Telehealth Podcast, where you can participate in collegial discussion with interprofessional telehealth thought leaders from around the world. Let's talk a little bit, Alison, about telehealth around the world, being our international representative here. What are your thoughts about this?
We're all sort of international with telehealth. We can Zoom anywhere. But I was involved with colleagues from 17 other countries. It was led by a team from Japan in looking at regulations that have changed over the course of the pandemic. And it was really interesting. I think there were three key things through this article. One is that regulations were relaxed in pretty much every country. So every country, I think, of the 17, saw telehealth as a way to meet increased need and create access to healthcare during the pandemic. And in order to do so, they had to relax some of their regulations, which is both positive and negative. We looked at things in the areas of, how clinicians are remunerated for their work, where they could provide service. So in some countries, they could only do rural service. In others, it opened up much more broadly. So there were differences, of course, across countries, but most of us saw relaxation. I think the bottom line for me and the next step is, again, this idea that it's been downloaded onto us to decide who is appropriate for telehealth care. And I think that is in need of further regulation. So what is the duty to care? And we know that duty to care is going to vary across different professions. So as a psychiatrist, I have a particular duty to care, which is really just like the minimum standard of care that I can provide. So things like meeting patient needs, transferring their care to other clinicians, prescribing, all of those things I need to decide if they're appropriate via telehealth. And if you're a psychologist, if you're a social worker, if you're a nurse, your duty of care is going to be different based on your role. So the bottom line of this very long study that we did was really that, yes, great, we relaxed regulations so we could see more people, but actually probably a lot more regulation is required going forward. And in most countries, there was even confusion, including in Canada and the US, about what was going to be sustained. Oh, and the only other one I'll mention is around platform, because I sort of talked a little bit about that before. When the pandemic happened in Canada, we have a specific platform we were supposed to use for telehealth prior to the pandemic. It had the highest level of security. It was centrally organized, as many things in Canada are. I think that's a big difference with the US, where there are multiple providers. But in a public healthcare system, we had one extremely secure provider that actually made it difficult. We did less than 1% of care via telehealth before the pandemic. The relaxation here was that you could literally use any platform. You could use Skype, you could use FaceTime, you could use whatever. And we're seeing that snap back because mainly of issues around privacy and security, I would say. So how easy it is to hack into that particular platform and whether health information and patient information is safe. So I think we saw a lot of widening of regulations, some snapping back, and unclear where it's going to land, which isn't a very satisfying answer, and does place a lot of pressure on us as providers, I think.
Thanks for listening to this excerpt from the latest episode of Optimizing Telehealth, your premium resource for evidence-based care. To access the full episode and to get your continuing medical education and continuing education hours, go to optimizingtelehealth.org.